Well, hello and good afternoon, everybody. My name is Jason Perry, and I'm the National Sales and Marketing Director here at Medicare Advantage Specialists. I'd also like to introduce you to MAS. We're a nationally recognized, award-winning field marketing organization and a leader in the insurance brokerage industry. Our office is located in beautiful Hoover, Alabama, which is just outside of Birmingham. MAS marketing managers and directors are eager to work with producers to help you grow your business. We can provide a market analysis of products available in your area to assist you in developing a strategic plan for your business. We're also always up to date on the latest products, carriers, lead programs, and services as they become available. And of course, we are always available to provide both back office and field support, making it easier for you to concentrate on sales growth. And our goal at MAS is to help you grow your business. And our specialty is the senior market, and our carrier portfolio is supported by Medicare Supplements, prescription drug plans, Medicare Advantage, final expense, whole life, term life, universal, annuities, hospital indemnity, critical illness, cancer, and dental, vision, and hearing plans. And for those of you that are interested in building an agency, we have an agency builder program. So let us help you build your agency. We can provide recruitment lists provided along with auto dialer capabilities to reach different agents very fast, specialized call campaigns that are created just for you, and then co-op opportunities are available for lead programs. And we're excited to share with you that MAS became a partner of Integrity Marketing Group back in October of 2019. We've had a long-standing relationship with Integrity Marketing Group over the years, and it was a natural alignment for us to become a platform partner. Through this, MAS will be able to bring more products, more tools, and more resources to our broker distribution. And we're truly honored to be working alongside other partners in our industry. So check out the new Medicare Center. It's a one-stop shop for everything and everything you need to successfully navigate the sales and enrollment process. You can now experience Medicare Center with the full power of CSG's resources, e-apps, data analysis, quoting tools, competitive analysis, heat maps, and an exclusive website plugin to capture MedSup leads. And here's our T65 locator. It makes it easy to find local Medicare prospects. It's quick to use, and pulling up locations on the map is a breeze. And the best part, it's free for agents who do business with Medicare Advantage specialists. And we also have the Lead Center. And the Lead Center is a part of the Medicare Center, which is exclusive to Integrity agents, where you can buy existing leads or generate your own lead campaigns. Existing leads are available for immediate purchase, whereas the lead campaigns are designed to generate new leads that are sent directly to the agent via email. And one of the many ways that Integrity helps their agents grow their business, Integrity buys leads in bulk and then offers them to the clients at their cost, as opposed to a lead company who sells leads for a profit. Now, so here's how you can contact us today after the webinar to discuss any of the topics that we've gone over. 800-480-9857 is our phone number. You can check out our website, MedicareAdvantageSpecialist.com as well. So now let's go ahead and get to today's topic, the ACE Medicare Supplement. And today we have with us Josh Martin with Integrity. And so, Josh, I'll go ahead and change presenter and give you control.
Awesome. Thank you. All right. Well, good afternoon, everyone. Let me get to sharing my screen here. Can everyone see that? It's just the Medicare Advantage Specialist logo there.
We can.
Okay, perfect. All right. So again, my name is Josh Martin. I'm with Integrity Marketing Group here out of Atlanta. I'm happy to come on here today and be a partner with Medicare Advantage Specialist. To go over what role Integrity plays in the Medicare industry, and then highlight the value of partnering together with Medicare Advantage Specialists and the support you can get through them, and as well as the carrier spotlight that we're going to go over today, the ACE Medicare Supplement. So just a little bit about where Integrity fits into this process. When everybody thinks of insurance, I know with me, when I thought of insurance, I typically thought of like your property and casualty, your auto insurance. And so as an insured, you think of just buying that from a name brand, and then every now and then you have to deal with an agent. And so from that, Integrity wanted to partner with the carriers and companies like MAS to make this process simple as it possibly can for you, the agent, and as well as the insured, so your client out there. And so what my role is here, I'm with the product development team here in Atlanta. I don't help develop the products, but we do have our leadership here in our office, and they sit up in our war room, as we call it, and they partner with the carriers to bring these products to market. So they work with everything from actuarials to make sure that the rates are right for the Medicare supplements, for the hospital indemnity plans, to make sure that they're competitive enough in the field for you as an agent so that you can sell those to your client. So when it comes to getting those products to the field, we also have partnered with a marketing agency called Thomas Arts. And if you've heard of them, that's great. If not, Thomas Arts is the agency of record for United Health and Aetna. And so what they do is they bring a very particular set of skills to Integrity with knowing how to build these materials as far as like advertising on social media, mailers, email. They speak the language of insurance. So we also have national career distributions here. We also have call centers, but the big thing that that it was the independent distribution. So that's each and every one of you on the call that's here today. And it's an important piece of that Integrity value chain, because partners like MAS and brokers they work with, like we want to make sure that you're well equipped and able to best serve and fit the customers, the consumers that are out there for you. And again, so technology and third-party administrators did that last thing there. And so the world today is technology driven. We all know that everything's going that way, from cell phones, and everybody's got one, from your 4-year-olds to your 94-year-olds. And so with that, Integrity wants to make sure that we're making the process as simple as it is out there. And so with that, we have the Medicare Center. We have your quote engines like CSG, and we want to make it easy for you to connect the carrier with the client and meet that client where they want to be met. So with that, these are the Integrity carriers that we partner with. And as you can see from here, from this screen, we're going to have everything from the name brands that are out there, the Aflacs, the Allstates, and you can't watch, college football on Saturday without seeing the Allstate commercials or the hands behind the field goals at the end of the field. And so the big thing with that, when we partner with these, that's free marketing for you as an agent. So when you go into a client's home, you're going to be able to say, hey, look, I have the name brands, but then you also have, we want to make sure that we have products out there also that are the most competitive when priced. So all these are going to be built on the best rates out there, and they're going to have their position in the market when it comes to that rate. This is a cool little tool that Thomas Arts has built for us. This is going to show the product availability for all of our carriers that we represent here, and then what state they're available in. There are some states that this needs to be updated because their states are already live. Alabama with ACE is already in there. But it's just a cool little tool, and this is one of the things that we lean on Thomas Arts for, to be able to give us and you, the agent, to use to make your life easy out there. So why sell our supplements? So I'm going to go over a little bit of the appeal process for the agent and the client, and that's going to be whether that's based on brand, rates, or underwriting niches that are out there with each carrier. We're going to go over a little bit about why these are profitable and what we do here in our office to make sure that you as an agent are making the most commissions and also the best incentives out there with these. These also, like I said, our team here in Atlanta, we want to make sure they're easy to work with, because we know that that you as an agent have many options out there when it comes to Medicare supplements. And so we want to make sure that when you are working with these that are ours, it's an easy process while you're sitting with that client. All right, so when it comes to brand, the appeal side, we want to make sure that, like I said, you have the top name brands out there. When you're going in and you sit and you're doing that client needs analysis with them, and they say, hey, I want this product A, you also have these brands. You can walk in and say, hey, look, I got the Aflac, I have the Allstate, I have the Humana. And then with that, you'll be able to make sure that those brand names are also there with the rates where they need to be. So we also make sure, like I said, that these products are positioned to sell, so that you have a competitive product to sell every time you're sitting with that client at their kitchen table, or if you're on the phone with them. You know, while they're not going to all have the lowest rates out there, we understand that, but they all have a unique position from a rate perspective to be competitive. And then the financial strength. This is one of the things here in our office when we're partnering with carriers, and they're working with them to try and decide what they're going to build as far as a Medicare supplement and bring it to market. You know, they want to make sure that they're partnering with somebody that's got a strong financial background, because that helps when it comes to rate increases. It helps with paying claims, and so we make sure that all of ours are strong financially. And again, you're going to see this. All of our products are going to be effortless to work with for you as an agent when you're sitting with that client. So again, profitable. We build in the top level commissions so that you as an agent, you're paid fairly for the products that you're selling and for the work that you're doing out there in the field with these clients. And the product sticks. What makes our supplements profitable for you is, when you look at Medicare supplement enrollees, 9 out of 10 of those enrollees are satisfied or happy with their coverage. So, they're going to be satisfied with the plan cost because those costs are predictable when it comes to that Medicare supplement. These are auto renewing, so they're not going to have to re-enroll every year for these supplements. And then the peace of mind, whether it be for the freedom to see a specialist without a referral. That's a huge piece when it comes to Medicare supplement. And then a cool little note here, there was an AHIP study done between December 2012 and December 2021 on original Medicare enrollees purchasing Medicare supplement. Coverage grew from 35% to 41%, which is great because when you look at and you hear that the Medicare Advantage is growing and Medicare supplements are dropping, I don't see that, especially from the integrity side. All the integrity products are growing year over year, which is a good sign. Because when you look at the future projected numbers, we have some TELUS Actuarial supplied some data to us that 65 million Medicare beneficiaries in 2022, and that's going to projected to grow to 78 million in 2031. So when you look at that, there is an estimated almost 18 billion in premium growth expected in Medicare supplements by 2031. So there is growth out there for Medicare supplements, and we want to make sure that we capture that, and we're putting the stuff out there for you as an agent where you can get that business. And we also, like I said, we also want to make sure that we have incentives for you as an agent when you sell, because we know that when you sell an MA plan, we want to make sure that you're getting right up there with the commissions on those MA, as well as our Medicare supplement. So with ACE for Q2, they extended their Q1 bonus. So for every underwritten case that you write with ACE, you will get $250 bonus. You have to write 5 to qualify for that, but as soon as you hit that 5th application that's issued, it'll retroactive back to that first one, so you'll get paid on all 5 of those. And again, one of the things that you may not see from the profitable side, but we view it as a profitable here in our office, is partnering with someone like Medicare Advantage Specialists for their support and the value adds that they bring along. And we'll get into some of those tools here in a second to kind of explain that a little bit more. So effortlessness. Like I said earlier, we partner with Thomas Art. They're one of our integrity partners. And what they do is when they build these materials, these are all pre-approved. They have turnkey materials for social media, email, flyers, mailers, anything like that. They provide for us for you, so you don't have to worry about trying to get things approved. The carrier feedback loop. So part of integrity also is another one of our partners, IAS, and they work with us. When we get feedback from an agent on, whether something's not seem to be working right on the e-app, on the portal, or the application, we want to make sure that feedback gets back to us because we want to take that to the carrier. We want to say, hey, look, we need to try and fix that, and we can sometimes get it fixed then, or if not, on the next product that we're bringing to market, we make sure that's changed on that. So big thing here is we want to hear from you as an agent who's in the field writing this, working with this every day. What are some of the issues that you're seeing with this, or if it's positive, we want to hear that too, obviously. The e-app signature process. I believe that we've created some of the best e-app signature processes out there. I'll get into the one specifically with ACE here when we get to that slide. But we want to make sure that these are easy when it comes to the signature as well as anything. And again, can't emphasize enough the support that MAS brings, partnering with integrity to you to help make this an easy process as well. And the last thing, the tools that we provide through your partnership, just having one contract with MAS, the tools that you're going to get free to use are invaluable to make your life easy. Jason, anything before we move on you'd like to jump in, feel free.
I think we're good.
Okay, all right. So again, this may look like a funny picture here, but just want to throw this out there and making sure when we talk about having the right tools will save you time and money and what's going to make it profitable for you as an agent. So when you're struggling with something because you don't have the right tool for the job, we want to make sure that when we're making our products, when we're building these with the carrier and we're bringing them to you, it's easy. So one of the tools, like Jason talked about earlier, is the Medicare Center. So inside the Medicare Center, you're going to have a CRM tool, call recording, quote and enroll. So you're going to have the CSG app inside there. And again, all of these are free to you as an agent with one contract through MAS. So inside the Medicare Center, you also have the Lead Center. So you're able to order health and life leads. You're able to sit online in the Medicare Center and do real-time campaigns and have calls coming into you. And then you also can connect with Medicare Center CRM and the call recordings together to where that client profile has everything, every call you've done with that client, every note you've taken, all will be right inside that system for you. And then CSG actuarial. So the MedSup and ancillary quoting and enrollment. Not all the products have the enrollment process yet in there, but we are working to make sure that that option is available for every carrier. You also have the MedSup consumer quoting tool, market reach, agent recruiting database. And then this next thing is inside CSG. So this is the market edge. So this is something that until recently I haven't fully understood, but now that I've kind of gotten into it, this is a huge piece I think that needs to be talked about a little bit more when it comes to an agent looking at areas to work. So, you know, if you're going to be sending out mailers, if you're going to be calling, when it comes to you marketing your business and you're trying to find new clients. So inside here, you're going to see these yellow to dark to orange to dark red, and you're going to basically, those dark reds are going to be your most saturated population areas. And so when you click on that state and you click on one of these areas, this is going to show you, so for this zip code area of 356, you're going to see population that's over 65, population turning 65, MedSup policyholders, and Medicare Advantage policyholders as well. And so as you can see from here, I pulled this up today. You know, these MedSup policyholder, and you add these together, it doesn't quite equal the population over 65. So obviously there are some out there that are probably still on group plans and whatnot, but there's business out there. And so the next step in this is, you know, breaking down even further inside that one little area to this zip code of 35603. You see it's going to show you the median household income for this area, and then those over 65 and turning 65, and then the number of policies of MedSup versus MedAdvantage as well. So this is really good because when you look at, you know, when you look at the population, you know, AHIP did a study where, you know, it says that enrollees, you know, typically a significant percentage of MedSup enrollees are people with lower income or higher income. But what we're seeing is that now, you know, there's a significant number of people out there that have incomes that are a little bit lower. So we're seeing 11% of annual household incomes have below 20,000, and then 24% of enrollees have an annual household income below 30,000. So there are those out there that, even though they have a lower household income, want the MedSup because they may be looking down the road at some more challenging health circumstances and may want that lower out-of-pocket risk in the future, and being able to work in that, you know, that monthly premium into their budget. So, you know, the big thing is when you look at it right now, currently there's 14 million American seniors that are covered by Medicare Supplement. So there is a market for this out there. We just got to make sure that we're using these tools like this to find that market and make sure that we're presenting these to these individuals. Even just because they have a lower income doesn't mean that, you know, Medicare Supplement may not be for them. We just want to make sure that we're giving them the option for that possibility. So just an example here of some of those turnkey materials I talked about that Thomas Arts builds for us, pre-approved, like I said, and these are something that you can reach out to MAS and they'll help you out with these. This is a T65. Jason spoke about this earlier as well. This is a free tool that you are able to get as an agent with a contract through MAS. This is great because this is going to show you down to a zip code, like I believe you can change, you know, 20-mile radius, 50-mile radius, the individuals that are turning 65, and then you're able to move this around state to state, wherever you have a license to sell. So this is a great tool. Just another close-up example of what you're going to see. So this isn't going to give you any cell phone numbers. This is going to give you the name, the address, and the number of days until they turn 65. So these aren't leads, we call them prospects for you if you're going to do something like a mailing campaign. So just a little screenshot here of the Medicare Center dashboard. From inside here is where you would go and to the lead center. You could go to the CSG app from inside here. Your CRM tools in here, as you can see, it's going to show you whether or not this is an inbound call, outbound call, and then give you the ability to link that call to a client or individual if you have their information put in. So just some great tools here. Again, if you're interested in any of these, because you already have a contract and you haven't work through this yet, contact MAS, reach out, and they'll help you out with this. So now let's get into why we're here with the ACE Medicare Supplement. So who is ACE? ACE is the world's largest publicly traded property and casualty insurance company. So if you've been in the insurance field, the market for years, you've probably heard of Chubb. So Chubb and ACE combined to bring this Medicare Supplement to market. And so Chubb, large P&C company, they bring more than 200 billion assets and reported gross premiums written in 2021. And so I bring this up because this just brings to the strong ability to pay claims, which is going to lend to the stability and the reliability of ACE, because when you go into that individual's home and they may not know the ACE name and want a name brand, but if they've heard of Chubb, that's that name brand, and then you can talk about what ACE brings with their rates. And so 93% of the Fortune 100 companies have at least one Chubb product. And then which all this to say, this leads to an A++ superior rating. So I've only ever heard of one other company having an A++ rating. But again, that leads back to the financial stability of Chubb and what they bring partnering with ACE. So some product highlights here. This is a footprint. This map is a little outdated. Idaho, Colorado, and Alabama are already live. And then as of May 1st, Florida, New Mexico, and Utah are live as well. Some highlights. So lowest base rates in most states. That's what ACE was built for. ACE was built to come in, have that low rate, but also have that financial stability with the Chubb name backing them. On top of that low rate, they have a 7% household discount one policy. So even with that being said, just 7%, some of those carriers out there with that 12% household discount, even with that, doesn't even come close to ACE when you look at some of their rates around the country. Again, mentioned this earlier, they're administered by one of our integrity partners, IAS. So it's good that we have that partner where we can go and say, hey, look, we want to make sure that this gets fixed or this gets changed. And we have a little bit of play when we bring this to market with having a company like IAS partnered with us. Typical plans, AFG, high deductible G&N. And then again, spoke about this a little bit earlier, our e-app. So on the question signature, so mother's maiden name. So we make that as simple as possible because some of these signature processes where you got to sign and text or email it back and forth can be a little confusing sometimes for seniors, especially if you're not sitting with them. So all they do is they put their mother's maiden name in that question signature. So if an underwriter calls, they're going to ask them that. And as soon as they give that mother's maiden name, it closes that loop and they're ready to go. So the appeal of ACE, brand name, the Chubb brings that along with them. The lowest rates, again, this was built as a rate play. ACE wanted to come in, not just to buy up, the market, but they wanted to make sure they had a good competitive rate with the strong financial backing to where they could hold that for a while and make sure that they were going to be competitive for a long time. A++ superior rated, year-round bonus programs. They're, like I said, they want to make sure they're giving the best bonuses out there as well as the top commissions, as we are as far as integrity goes. So that's why they continued that Q1 bonus into Q2. So some underwriting highlights. Pretty good here with the 2-year look back on the heart, cancer, and stroke. That's pretty good. I know there are some out there when you look at cancer and stuff and they go 3 to 5 years. Diabetes, they want to make sure they're not just turning people away. They will allow up to 50 units of insulin daily. And then the combo medications, they count for high blood pressure or diabetes will count as 2 independent medications. So they're not coming in, like I said, and saying we're just going to turn everybody away if you have any issues. They just want to make sure that they're not putting that agents aren't putting unhealthy blocks of business on them with that low rate. They want to make sure that, like I said, they're going to be stable for years to come. But the incentive, again, show you this, $250 for each underwritten case, qualified after written 5, and then you will get paid on all those first 5 as well. So with that being said, what's the next steps? The next steps are to reach out for contracting if you don't have ACE or any of the other products that through MAS with integrity that we offer. If you do have this and you're interested in some of those other tools that I went through earlier, reach out, ask them about some training on that. Reach out to me, have them reach out to me. I'll help and do some training on those tools as well. Anything I can do to be of assistance, I'm here for.
Awesome. Thank you, Josh. I appreciate that. And I'd like to mention that the contracting is super easy for this particular carrier. It's just a e-contract, so super fast to get appointed. So if I don't see any questions, if anybody wants to put a question in, we can try to knock that out. But if there aren't any questions, we really appreciate you spending time with us today. Thank you, Josh, for educating us. And folks, this is an awesome heads up. So please reach out to us. We'd be happy to get you set up with it and help you grow your business.
Yep. Thank you so much.
All right. Take care, everybody. Thank you. Bye-bye.